Modern medicine has a funny way of looking at the human body. It treats you like a used car. They wait for something to rattle, spray some WD-40, a statin, or some other symptom-suppressing drug on it, send you on your way, and hope you make it to the next inspection. If the engine blows, they suggest a transplant. It's a reactive, fix-it-when-it's-dead philosophy that keeps the pharmaceutical giants and medical device manufacturers in yachts while you're left wondering why you still feel like a bag of wet, rusty hammers. At ARTC, we do things differently. We don't just manage symptoms, we speak the body's language. And part of that language is written in peptides, along with proper nutrition, exercise, metabolic, and hormonal balance, and more. If you've been scouring the internet for information on peptide protocols Sarasota patients can trust, you've likely found yourself in a digital swamp of gym bro advice and questionable overseas pharmacies. You deserve better than an amateur's guess at your biology. This is the physician's guide to what actually works, why it works, and how we use these signaling molecules to reboot your cellular hardware. In other words, this is how I approach Peptide Protocol Sarasota without the nonsense, the guesswork, or the internet clown show. Let's get one thing straight. Peptides are not drugs in the traditional sense. They are short chains of amino acids, anywhere from 2 to 50 plus amino acids long, essentially part of your body's biological software. They act as targeted signaling molecules that tell your cells exactly what to do. Think of your DNA as the hard drive. Peptides are the command lines that tell the computer to run healing.exe or optimize fatburn.cmd. They're only classified as drugs when they pass the FDA approval process for a particular disease process. Most will never be approved because they can't be patented, so no one will spend the billion-dollar-plus price tag required to get them approved. Because they are endogenous, meaning your body already produces them. They're far more targeted and modifiable than traditional hormones. While a hormone like testosterone is a blunt force tool that affects hundreds of systems, a peptide is a sniper. It goes in, hits a specific receptor, and triggers a specific response. The problem? Most of what you read on Reddit or YouTube is bro science self-experimentation, although some of the information is based on real science. People are injecting research-grade chemicals into their bodies with no concept of mitochondrial intermembrane damage or systemic signaling crosstalk. True excellence in medicine requires a physician-led approach to peptide protocols that Sarasota patients can rely on for safety and superphysiologic results. Of course, that physician or other health professional needs to be well-grounded in promoting health rather than just treating disease and masking symptoms. If I had to pick the most transformative discovery in regenerative medicine over the last 30 years, it would be BPC-157. BPC stands for Body Protection Compound. This is a sequence of 15 amino acids found in human gastric juice. Its job in nature is to keep your gut from eating itself. In the clinic, its job is to accelerate the healing of tendons, ligaments, and muscle tissue. Precise delivery of peptide protocols in Sarasota at ARTC for tissue repair. Precise delivery of targeted signaling molecules for tissue repair. BPC-157 works through angiogenesis, the creation of new blood vessels, and the upregulation of growth factor receptors. It doesn't just mask the pain of a torn rotator cuff. It actually signals the body to rebuild the scaffolding. BPC-157 is typically stacked with TB500, Timosin beta-4. While BPC-157 is the local builder, TB500 is the systemic architect. It promotes tissue regeneration and actin regulation, making it a powerhouse for wound healing and overall recovery. It helps the right repair cells get where they are needed. A study published on PubMed highlights BPC-157's profound regenerative properties, particularly in musculoskeletal healing. This isn't rocket science. It's just giving your body the blueprints it lost 10 years ago. A quick note about this combination, typically referred to as the Wolverine stack. Although many peptide suppliers combine them in a single vial, that is not the proper way to use them. TB500 should be used 1 to 2 times a week as a higher bolus rather than daily as with BPC-157. That's why we recommend them in separate vials. Now let's talk about the anti-aging darling, growth hormone and its secretagogues, GHS. Mainstream medicine loves to scare people about HGH, human growth hormone. They'll tell you it's dangerous, while they happily prescribe you synthetic opioids that would kill a horse. Human growth hormone has been the foundation of anti-aging interventions for over 40 years, and with good reason, it definitely moves the needle toward more youthful functioning. The big problem, however, is that the government classified it as an anabolic steroid, which it is not. That classification and the oversight that goes along with it has intimidated doctors, making them much less likely to recommend or prescribe it. Enter growth hormone boosters. The reality is that as you age, your GH levels drop off a cliff. This leads to muscle wasting, belly fat, and skin that looks like a crumpled paper bag. Instead of injecting HGH directly, which suppresses or shuts down your natural production, we use peptides like ipamorelin and CJC-1295. Ipamorelin, a selective secretagogue that stimulates pulsatal GH release. It doesn't spike cortisol or prolactin. It's clean. CJC-1295 without DAC. This allows for precise dosing and acts as a GHRH, growth hormone releasing hormone analog. By combining these two, we create a sustained GH signal that mimics your body's natural rhythm. Research on CJC-1295, as seen on PubMed, shows its ability to significantly increase growth hormone and IGF-1 levels safely. The result? Lean muscle support, better sleep, and an anabolic environment that helps you feel like you're 25 again, without the risks of HGH suppression. Most weight loss advice is garbage. Eat less, move more is a platitude from the 1950s that ignores the fact that most Americans have trashed mitochondria and severely damaged and restricted microvascular health. If your cellular engines are broken, you can't burn fat efficiently, no matter how many miles you log on the treadmill. That's exactly why peptide protocols Sarasota patients use for metabolic repair need to address cellular function, not just calorie math. This is where MOTS-c comes in. It's a mitochondrial-derived peptide that improves insulin sensitivity and mitochondrial biogenesis. It literally tells your body to build more engines. However, I never recommend MOTS-c in isolation, at least not initially. It should almost always be preceded by or combined with SS-31, elamipretide. Why? Because SS31 repairs the mitochondrial inner membrane damage that is rampant in our toxic high-sugar society. You can't tune a car with a cracked engine block. We fix the block with SS31, then we supercharge the performance with MOTS-c. This is the level of sophistication we bring to peptide protocols Sarasota residents need to actually change their body composition. In reality, there are several other things we recommend to restore proper mitochondrial levels and functioning. EWOT, exercise with oxygen therapy, is a prime example, along with HIIT, high-intensity interval training. Several key nutrients must be on board for mitochondria to function properly. If you're losing your hair, you've probably tried the foams and the pills that come with side effects, like, well, things you don't want to happen in the bedroom. This is another area where peptide protocol Sarasota patients ask about can be tailored with far more precision than the usual pharmacy roulette. AHK-Cu, copper tripeptide 3, is the hair restoration peptide. It stimulates dermal papilla cell proliferation and upregulates VEGF, vascular endothelial growth factor. It basically wakes up dormant follicles and provides them with the blood flow they need to survive. We integrate this into our broader hair restoration Sarasota programs. For the skin, GHK-Cu is the gold standard for collagen synthesis and wound healing. It's not just beauty stuff. It's about the structural integrity of your largest organ. When you combine these with copper peptide hair restoration Sarasota protocols, you aren't just painting over the rust. You're replacing the metal. At ARTC, we don't do one size fits all. We build stacks. Here are the 6 primary protocols we deploy based on your clinical needs. This is the ultimate recovery stack for those coming off surgery or dealing with chronic injuries. We combine BPC 157, TB 500, KPV, an anti-inflammatory peptide, and GHK-Cu. It's like having a 24/7 construction crew inside your joints. Among the peptide protocols Sarasota patients request for orthopedic recovery, this one is a workhorse. For those struggling with metabolic resistance, we utilize retatrutide, a triple agonist, MOTS-c and SS-31. We often add SLU-PP-332 to enhance endurance and CJC-1295 and ipamorelin to maintain lean mass while the fat melts off. Done correctly, peptide protocols Sarasota patients use for fat loss should protect muscle while restoring metabolic flexibility. Please note that any program that helps a person lose body fat will also cause them to lose lean muscle weight unless they are making sure that they are getting optimum amounts of protein and doing regular resistance training. These are 2 things we emphasize at our center. Vascular health is the foundation of everything, from heart and brain health to hormonal sexual health and everything in between. We use bioregulator peptides like Vesugen and Cardiogen to support the endothelium and cardiac muscle. This is one of the more overlooked peptide protocols Sarasota patients benefit from when circulation is the real bottleneck. As with everything, peptides alone are not the complete answer. Other components are recommended to help repair and restore the microvascular system to more youthful levels. This is the engine overhaul. As mentioned, SS31 is the star here, repairing the inner mitochondrial membrane, followed by MOTS-c to boost energy output. We often pair this with EWOT Sarasota, exercise with oxygen therapy, to flood the system with the fuel it needs to heal. In my clinic, peptide protocol Sarasota patients use for energy are never just about stimulation. They're about rebuilding the engine. We offer EWOT in office, or if preferred, we help people obtain a system for their home that can be used by the whole family and makes the periodic refreshers more convenient. Cognitive decline isn't inevitable. It's often a lack of repair signals. We use cerebrolysin, Selank, and Cmax as the foundational peptide protocol for brain health, peptides that act as neurotrophic, brain-nourishing factors, to support focus, memory, and nerve regeneration. These peptide protocols for Sarasota patients exploring brain performance are especially valuable when stress and inflammation have hijacked the system. When dealing with nerve damage, such as occurs in peripheral neuropathy, we also add ARA290 to the mix, as it has been shown to help nerves regenerate. These are combined along with several other things for our peripheral neuropathy protocol. In a world that seems determined to keep you sick, your thymus gland, the master of your immune system, starts shrinking after puberty. We use thymosin alpha-1, thymulin/thymolin, and LL33 to reboot your immune response and keep you resilient. For resilience and recovery, peptide protocols. Sarasota patients choose often need this immune layer addressed instead of ignored like some bureaucratic afterthought. Once again, there are other things that we combine with these peptides to support immune health synergistically. You might be tempted to buy research chemicals online. Let me give you a reality check. When you buy from a random website, you have zero guarantee of purity. These labs aren't regulated. You could be injecting something that contains heavy metals, fillers, or worse, nothing at all. I'm all for people having free access to things that are safe and can help improve health and function, but it is important to do your homework to ensure that what you are getting is the real deal. That's one reason why it is best to work with a properly educated health professional when sourcing your peptides. Furthermore, stacking logic matters. Peptide interactions are real. Some amplify each other, others conflict. If you're taking a GH-Secretagogue, but your insulin is through the roof, you're just spinning your wheels. Balancing blood sugar and insulin is the very foundation of metabolic health and achieving biological sovereignty. At ARTC, every one of our peptide protocols Sarasota patients receive is physician supervised. We use pharmaceutical-grade compounds from accredited compounding pharmacies and manufacturers. We recommend monitoring your labs, tracking GH, IGF-1, and metabolic markers to ensure you're moving toward regeneration, not just expensive urine. That physician oversight is why peptide protocols Sarasota patients receive here are built for outcomes, not internet theater. We don't guess. We test and base our recommendations on your health challenges and goals. Testing can be very helpful, but learning about your body involves more than running blood work. Your journey starts with a comprehensive assessment. We look at your blood chemistry, your hormonal baseline, and your specific goals, whether that's recovering from a sports injury or reversing your biological age. The best peptide protocol Sarasota patients follow start with data, because biology does not care about hype. Assessment, detailed blood panels to find the why behind your symptoms. Stacking, we design a multi-peptide protocol where each compound supports the other. For example, SS31 before MOTS-c. There are many great peptides, but they should be properly stacked and rotated for optimum results. Monitoring, we adjust your dosage based on real-time feedback and follow-up labs. This is an ever-evolving process customized to your biology. Are you an athlete looking to cut recovery time in half? An executive who can't afford brain fog? Someone over 50 who refuses to accept slowing down as a lifestyle? If you are looking for advanced medical solutions that go beyond the Band-Aid approach of traditional medicine, you are a candidate. We work with individuals who are proactive about their health and want to increase their health span. People who are tired of the mainstream's one pill for every ill mentality. In plain English, peptide protocols Sarasota patients do best with are designed for people who actually want regeneration, not another shrug and a refill. The world of peptides is the future of medicine, but it requires an expert hand to navigate. Don't settle for good enough when it comes to your cellular health.